Welcome to Health Talk. I'm Dr. Manny. Fatalities from opioid overdose have quadrupled from 1999 to 2010. That's according to a JAMA study. Many of those cases are teens. And believe it or not, misuse often begins in the dentist's office. The American Dental Association recently reported dentistry is responsible for prescribing 12% of all instant-release opioids. Joining me now to talk about this growing problem is Dr. Mushkan Fajaram from Sutton Advanced Cosmetic Dentistry. Welcome, Doc.
Thank you, Dr. Manny.
Nice to see you.
Nice to see you.
Look, I'm amazed about the statistic, and the dental industry is saying that, one of the biggest groups of or health sections of prescribing pain medicines like opioids is the dental community. Do you see that as a problem?
I actually do. Our industry just gives out the opioids way too quickly just to treat chronic pains. No one likes a dentist, Dr. Manny. Who are we kidding?
Right.
So it makes it easier when patient has a little pain to write the opioid prescription, the little narcotic, and just say, don't call me, come see me in 7 days, and everything will be better.
You know, there's a lot of legislation being thrown out there now. For instance, a couple of district attorneys in different states are trying to put legislation that says, look, we want the doctors, dentists or medical doctors, to just give out like 5 days of painkillers. The pushback from the health industry has been, well, you know what, there are certain procedures that require more pain medication. But dental procedures per se, what's the pain threshold? In other words, if you do a root canal, how many days do you really are going to be needing, opioids for pain?
Almost none. You can control that much better with just taking acetaminophen and ibuprofen as a combination together. It decreases the inflammation, Dr. Manny.
Right.
It doesn't have all the abuse. It doesn't have all the other adverse effects of vomiting, headache, nausea. So there's really no need for that. You have a root canal unless you're really inflamed.
We want to get on the alternative opioids, but let's talk about the teen population. You are one of the most prestigious dental experts here in Manhattan. When you have younger teenage patients, how do you handle them, especially if they're demanding painkillers?
I have, unfortunately, a lot of them who come in and literally write the prescription for you, telling you what they want. And my answer to them is no. You just take, if you really have a lot of pain, you take Advil. You just mix it with Tylenol and you should be fine. They do question you a lot of time, and they do tell you that, no, my pain is really severe and I need to go back to school. Well, my answer is just simply no.
Right. Now, dental surgery, especially gum surgery, is, it's debilitating and painful. Are there any things that people can do? You talked about Advil, Tylenol. Any alternative therapies out there that would relieve inflammation, especially after dental surgery, that would kind of take you away from giving, opioid medicines?
100%. Again, using ice, just plain ice, to put on 20 minutes and take off 20 minutes would decrease the inflammation right there.
Right.
And just taking, again, Advil and just regular ibuprofens and acetaminophen will decrease that tremendously. There is really, even for gum surgery, even for extraction, unless it's impacted tooth that they're removing, you don't need to take any of the opioid or narcotic.
Now, one common dental procedure or dental condition that a lot of people complain is TMJ. Now, this gets a little bit into the chronic pain. It's like chronic back pain. A lot of people that have chronic back pain, they go to the doctor, they do this and the other, but usually these folks are in a high-risk category for becoming addicts, or at least dependent on opioids. What's the deal with TMJ? How should that be treated?
There are mouth guards now that tremendously help, just controlling your TMJ. That now we can actually give Botox right in the condylar area, and it really do help. Botox do help the pain a lot.
Right.
There's acupuncture that you can use. I have actually a doctor that does that, and patients are very, very happy with it. So there are many ways to do it before you go again to actually push the patient into analgesics.
All right. So here's the bottom line, because I'm a big proponent of less regulation. The criticism in the health industry is that we doctors sometimes don't monitor ourselves well and don't, we don't do sometimes what we should be doing. How is, now that we have these facts, right? We have the opioid epidemic, teenagers dying overwhelmingly in large amounts because they have become addicted through opioids and then they end up with heroin. What is the dental industry doing to regulate itself? I mean, what is the dialogue that when you go to your conferences and you hear the literature in the dental world, what's happening with trying to reduce this 12% infiltration of use of opioids in the dental industry?
Sadly, there isn't much talk, Dr. Manny. There really isn't. I do go to a lot of conferences, and it really isn't because a lot of surgeons are pushing that there is a need for it. So sadly, there really isn't much talk about it. But but now this whole thing with the DEA regulating us to do the e-prescribe versus a regular prescription by pad, that regulates it a lot more. Because the patient cannot go to oral surgeon, get a Vicodin, and then come to me and ask for Vicodin because by then, we get alerted by that. The pharmacy gets alerted. So that helps a little bit to regulate it.
What advice would you give to patients to think about the use of these drugs?
Same advice I give to my own kid and my own family, Dr. Manny. You don't need it. If you're an adult and you take it and you bring it and you put it in your cabinet, it's going to end up in your children's room. You know that. That's where children gets it. You don't need it. And if your children are having the dental thing, they don't need it either. Just do it by Tylenol and they should be fine.
All right. Well, listen, you're the expert.
Thank you,
best
Dr.
in
Manny.
New York for sure. Well, thank you so much for joining us.
Thank you,
Very
Dr.
important
Manny.
segment. I never realized that, through dentistry, people are also getting exposed to these medications. So thank you very much for being here.
Thank you, Dr. Manny.
And if you have a health question, tweet me at Dr. Manny on Fox. Until next time, I'm Dr. Manny.